Our top story tonight, Kerala's health minister, Veena George, has announced that the state's high-level COVID committee is closely monitoring the occupancy rates of ICU beds, oxygen beds, and ventilators in government and private hospitals. This comes in response to a slight rise in COVID-19 infections in the state. Health Minister Veena George stated that the committee is diligently checking for any increase in the occupancy of critical medical facilities. Conducting an online mock drill from December 13 to 16, involving 1,192 government and private hospitals, the state has prepared a total of 1,157 oxygen beds, 2,454 ICU beds, and 937 ICU beds with ventilator support. Minister George urged the public not to panic or spread fear, emphasizing that the rise in infections has been under observation since November. Whole genome sequencing tests revealed the presence of the JN.1 subvariant of the Omicron variant in a 79-year-old patient from Karakulam, Thiruvananthapuram. While highly transmissible, it is not considered severe. The health minister noted that 15 travelers from India had tested positive for the JN.1 subvariant during routine surveillance at the Singapore airport, indicating its presence in other Indian states. The center has issued an advisory to all states, including Kerala, to maintain continuous vigilance. In other COVID-related news, Singapore has recorded 56,000 more cases in a week, prompting the re-implementation of mask mandates. Kerala reported one death due to the JN.1 subvariant, and India's active caseload has surged to 1,828. The central government has issued an advisory to state governments to make adequate health arrangements. Meanwhile, Karnataka's health minister, Dinesh Gundu Rao, stated that the state currently has 58 active cases of COVID-19. Testing has been increased in hospitals, with a focus on border areas. In the United States, 17 states have reported high or very high levels of respiratory illness activity as COVID-19 and flu hospitalizations increase. On the global front, the Chinese mainland has detected 7 mild and asymptomatic cases of the JN.1 subvariant, with at least 40 other countries reporting its presence. A Beijing-based immunologist reassures the public that new variants may emerge, but it is not a cause for concern.